Have you ever felt lost in the maze of your own medical history? Trying to remember that diagnosis from 5 years ago? Or maybe you've moved cities and faced the frustrating task of transferring your records to a new doctor. Worse yet, have you worried about the security of your sensitive health information stored in disparate, vulnerable systems? These aren't just hypotheticals. They are everyday realities for millions of people navigating today's healthcare landscape. Our health data, arguably the most personal information we possess, is often fragmented, inaccessible, and insecure. But what if there was a better way? A way to put you, the patient, firmly in control of your medical history, ensuring it's secure, complete, and instantly accessible when needed. Imagine a future where your entire health journey is documented accurately, stored immutably, and shared only with your explicit consent. This isn't science fiction. This is the power of blockchain technology applied to medical records. And today, we're diving deep into how a revolutionary startup is making this vision a reality. Welcome to our exploration of blockchain-based medical records. Your health data secured forever. We'll look at how this technology works, its profound benefits, and how one innovative company is building a decentralized platform poised to transform healthcare information management as we know it. Let's start by understanding the problems with the current system. Why do we even need a change? Today, most medical records exist in silos. Your primary care physician has one set of records, your cardiologist another, the hospital you visited last year yet another. These systems, often electronic health records or AR, usually don't talk to each other effectively. This lack of interoperability is a massive hurdle. It means doctors often don't have a complete picture of your health, leading to redundant tests, potential medication errors, and delays in treatment. Think about the administrative burden. Faxing records, requesting files, waiting for information, it's inefficient and costly. Then there's the issue of data integrity. Records can be incomplete, contain errors, or even get lost. Paper records degrade, and digital records can be altered or corrupted. Security is perhaps the most significant concern. Centralized databases holding vast amounts of sensitive patient data are prime targets for hackers. Data breaches are alarmingly common, exposing millions to identity theft and privacy violations. The cost of these breaches, both financial and reputational, is staggering. And finally, patient control is minimal. Often you don't truly own or easily control access to your own health information. Getting copies can be cumbersome, and you have limited say in who sees your data and when. Beyond basic consent forms signed years ago, this fragmented, insecure, inefficient, and provider-centric system is ripe for disruption. Enter blockchain technology. Now, what exactly is blockchain? You might associate it with cryptocurrencies like Bitcoin, but its potential goes far beyond digital money. At its core, a blockchain is a distributed, immutable, and transparent digital ledger. Let's break that down. Distributed means the ledger isn't stored in one single place. Instead, copies are spread across many computers in a network. This decentralization makes it incredibly resilient. There's no single point of failure or attack. Immutable means that once data is recorded on the blockchain, in a block and added to the chain, it cannot be altered or deleted without the consensus of the network. Each block is cryptographically linked to the previous one, creating a secure and tamper-proof chain of records. Transparent means that while the contents might be encrypted for privacy, the existence of transactions or records is verifiable by participants on the network. So how does this apply to medical records? Imagine each medical event, a doctor's visit, a lab result, a prescription being recorded as a transaction on a secure blockchain. This doesn't necessarily mean storing the entire medical record itself on the blockchain, which could be inefficient and raise privacy concerns. Instead, the blockchain can act as a master index, a secure pointer system. It can store cryptographic hashes, unique digital fingerprints of medical records, along with metadata like timestamps and permissions, while the actual records remain securely stored off-chain, perhaps in encrypted distributed storage. This approach leverages blockchain's strengths, security, immutability, auditability, without compromising the privacy or scalability needed for handling large medical files. Now, Let's talk about the startup at the heart of this transformation. Let's call them MediLedger Secure. Their platform is designed from the ground up to address the shortcomings of traditional systems. MediLedger Secure isn't just storing records. They're creating a patient-centric ecosystem. Here's how it works for a patient. You sign up for the platform, likely through a secure app. Your identity is verified using robust methods. You are then given a unique digital identity on the blockchain, linked to a pair of cryptographic keys, a public key like your address, and a private key like your password, which only you possess. Your private key is crucial. It's what you use to digitally sign transactions, essentially giving permission for actions related to your data. Lose your private key and you lose access. Security is paramount. When a healthcare provider, say, your doctor adds a new record like consultation notes or test results, they request permission to add it to your profile. Using your app, you grant consent with your private key. The record itself or its hash and pointer is then added to the ledger, linked to your identity, time-stamped, and cryptographically secured. Now, imagine you need to see a specialist. Instead of faxing records, the specialist, also a verified user on the MediLedger Secure platform, requests access to specific parts of your record. You receive a notification on your app. You can review the request, who is asking, what they want to see, and for how long. You then use your private key to grant temporary granular access. Perhaps you only allow access to cardiology reports, not your entire history. The specialist instantly receives verified, up-to-date information. The access grant is logged on the blockchain, creating an immutable audit trail. You can revoke access at any time. You are in complete control. This is a paradigm shift from the current model. Let's delve deeper into the technology MediLedger Secure might be using. Smart contracts are a key component. These are self-executing contracts with the terms of the agreement directly written into code. They run on the blockchain and automatically enforce rules. For example, a smart contract could manage access permissions. When you grant access, the contract verifies your digital signature and the provider's credentials, then automatically allows data retrieval according to the parameters you set, e.g., time limit, data type. Encryption is fundamental. All sensitive data, whether stored on-chain, less likely for full records, or off-chain, is heavily encrypted. Only individuals with the correct cryptographic keys, primarily the patient, or those granted permission by the patient, can decrypt and view the information. Hashing, as mentioned earlier, creates those unique digital fingerprints of data. Even a tiny change to the original record would result in a completely different hash. By storing these hashes on the immutable blockchain, MediLedger Secure ensures data integrity. Anyone can verify that a record hasn't been tampered with since it was added. Consensus mechanisms are the rules by which the distributed network agrees on the validity of transactions before adding them to the blockchain. For a healthcare blockchain, this likely involves a permissioned or consortium model where only authorized participants, like verified hospitals, clinics, labs, and patients, can validate transactions, ensuring a higher level of trust and regulatory compliance than public blockchain. Data storage strategy is crucial. MediLedger Secure likely employs a hybrid approach. The blockchain stores immutable pointers, hashes, and access logs. The actual bulky medical data, images, detailed notes might be stored in encrypted decentralized storage systems like EPAs, interplanetary file system, or secure cloud repositories, accessible only via the pointers verified on the blockchain with patient consent. So, what are the tangible benefits of a system like MediLedger Secure? Let's look at it from different perspectives. First, for patients, unprecedented control. You own your data. You decide who sees it, what they see, and for how long. Access is granted explicitly, not assumed. Enhanced security and privacy. Decentralization eliminates single points of failure. Cryptographic encryption protects data confidentiality. Immutable logs prevent tampering. Data portability. Your health record follows you, securely accessible anywhere. Improved accuracy and completeness. A single longitudinal record reduces errors and gaps caused by fragmented data silos. Empowerment. Access to your complete, accurate health history empowers you to be a more active participant in your own care, leading to better health decisions. Reduced hassle. No more chasing down records or filling out repetitive medical history forms for every new provider. Now, let's consider the benefits for healthcare providers. Instant access to comprehensive data. With patient consent, doctors get immediate access to verified, up-to-date patient history regardless of where care was previously received. Improved diagnostic accuracy. A complete picture reduces the chance of misdiagnosis due to missing information. Allergies, past conditions, medications, it's all there. Reduced errors. Eliminates redundant testing and lowers the risk of adverse drug reactions by providing a clear view of current and past medications. Increased efficiency. Dramatically cuts down administrative time spent requesting, sending, and reconciling patient records. Streamlines workflows. Enhanced care coordination. Specialists, primary care physicians, and hospitals can seamlessly share information with patient permission, leading to better coordinated care plans. Data integrity assurance. Providers can trust the data they are viewing knowing it hasn't been tampered with, thanks to blockchain's immutability. And what about the broader healthcare ecosystem and researchers? Interoperability solution. Blockchain can act as a universal adapter, allowing different AR systems to interact indirectly via the shared ledger, overcoming long-standing interoperability challenges. Accelerated medical research. Patients could choose to grant anonymized access to parts of their data for research purposes, significantly speeding up clinical trials and medical discoveries. Imagine the power of large, verified longitudinal datasets for studying disease patterns and treatment effectiveness, all while protecting individual privacy. Improved public health monitoring. Aggregated anonymized data shared on the blockchain could provide real-time insights into public health trends and outbreaks. Streamlined insurance claims. Smart contracts could automate aspects of insurance claim processing, verifying treatments received against approved plans, reducing fraud and delays. Cost reduction. Increased efficiency, reduced administrative overhead, fewer redundant tests, and lower potential for fraud all contribute to significant cost savings across the system. Let's double-click on security again, as it's so central to MediLedger Secure's proposition. Traditional systems centralize data, creating honeypots for attackers. A single breach can compromise millions of records. We see headlines about this constantly. Blockchain's decentralized nature fundamentally changes this. There is no single server to hack. An attacker would need to compromise a significant portion of the network simultaneously, which is computationally infeasible, especially on a well-designed permission network used for healthcare. The cryptographic hashing ensures data integrity. If anyone tries to alter a past record, the hash will change, and the network's consensus mechanism will reject the fraudulent block. Patient control via private keys means only the patient can authorize access. Even MediLedger Secure, the platform provider, cannot access patient data without their consent. The immutable audit trail logs every access request, grant, and data addition. This transparency provides accountability and helps detect any unauthorized access attempts. Of course, no system is perfect, and implementing blockchain in healthcare isn't without challenges. Let's address some potential hurdles. Scalability. Processing a high volume of transactions quickly can be challenging for some blockchain architectures. Healthcare generates vast amounts of data. MediLedger Secure needs to utilize efficient consensus mechanisms and potentially layer 2 solutions or optimized data storage strategies like the hybrid model to handle the load effectively. Interoperability standards. While blockchain can facilitate interoperability, it needs to integrate with existing healthcare standards like HL7F, fast healthcare interoperability resources. The platform must be designed to read, interpret, and exchange data in standardized formats to connect seamlessly with existing hospital systems. Regulatory compliance. Healthcare is heavily regulated: HIPAA in the US, GDPR in Europe, etc. Any blockchain solution must strictly adhere to these regulations. This involves careful design around data privacy, patient consent mechanisms, data residency rules, and the right to be forgotten. which can be tricky with immutable ledgers. MediLedger Secure likely addresses the right to be forgotten by ensuring personal data isn't stored directly on the immutable chain, allowing off-chain data to be deleted, while leaving an auditable, but perhaps anonymized or broken, link on the chain. User adoption and education. Both patients and healthcare providers need to be educated about how the system works and its benefits. Overcoming inertia and resistance to change is key. User interfaces must be intuitive and easy to use, especially for patients managing their private keys and permissions. Cost of implementation. Integrating a new blockchain-based system requires investment from healthcare institutions in terms of technology, training, and potentially changing workflows. However, the long-term cost savings from efficiency and reduced errors often outweigh the initial investment. Data standardization. Ensuring data entered from various sources is consistent and coded correctly remains a challenge, even with blockchain. MediLedger Secure needs robust validation rules and integration with standard medical terminologies like SNOMED CT or ICD codes. Despite these challenges, the potential benefits are driving significant interest and development in this space. Several pilot projects and startups are exploring blockchain for healthcare records globally. Some focus on specific use cases like managing consent for clinical trials, tracking pharmaceuticals to prevent counterfeiting, or securing credentialing for medical professionals. MediLedger Secure's ambition lies in creating a comprehensive, patient-controlled record system. Imagine the impact in an emergency. You arrive at an unfamiliar hospital, perhaps unconscious. With a system like MediLedger Secure, emergency personnel with pre-authorized emergency access protocols, potentially via a medical ID linked to the system, could instantly retrieve critical information. Allergies, blood type, chronic conditions, current medications. This could literally be the difference between life and death, eliminating guesswork in critical moments. Consider managing chronic diseases like diabetes. Patients could grant continuous, permissioned access to specific data streams, like glucose monitor reading, to their care team, allowing for proactive monitoring and timely interventions, all recorded immutably. Think about clinical trial recruitment. Patients meeting specific criteria could be notified if they opt in and easily share relevant verified health data with researchers, drastically accelerating the pace of medical innovation. The future vision enabled by platforms like MediLedger Secure is one of a truly connected, patient-centric healthcare ecosystem. It's a future where data flows securely and seamlessly, empowering patients, enhancing provider capabilities, and driving better health outcomes for everyone. It promises a move away from reactive sick care towards proactive health management, enabled by accessible, reliable data and patient engagement. MediLedger Secure and similar initiatives are not just building technology. They are advocating for a fundamental shift in how we view and manage health information. They are placing trust, transparency, and individual control at the forefront, leveraging blockchain's unique properties to achieve this. Let's reiterate the core value proposition: security, control, efficiency, and trust. Security through decentralization and cryptography, protecting data from breaches and tampering. Your health data secured forever. Control placed firmly in the hands of the patient, managing access with cryptographic certainty. Efficiency gained by eliminating data silos, reducing administrative waste, and providing instant access to verified information. Trust built through transparency, immutability, and the auditable nature of blockchain transactions. Verifiable data integrity for all participants. The journey towards widespread adoption of blockchain-based medical records is still ongoing. It requires collaboration between tech companies, healthcare providers, regulators, and patients. Standards need to solidify, and trust needs to be built. But the trajectory is clear. The inherent flaws of our current systems, coupled with the compelling advantages offered by blockchain, make this evolution seem not just possible, but increasingly inevitable. Startups like MediLedger Secure are paving the way, demonstrating the real-world applicability of this powerful technology to solve critical problems in healthcare. They are building the infrastructure for a future where managing your health information is as easy, secure, and intuitive as managing your finances online. So, what does this mean for you? Keep an eye on this space. Ask your healthcare providers about their plans for improving data access and security. Support initiatives that promote patient data ownership and interoperability. Educate yourself about the potential of technologies like blockchain to improve your healthcare experience. The transition won't happen overnight, but the promise is immense. A healthcare system powered by secure, accessible, patient-controlled data. A future where your health data is truly yours, secured forever, and working to keep you healthier. Thank you for joining us on this exploration. We've only scratched the surface of this exciting field. The intersection of blockchain and healthcare holds incredible potential. Consider the implications for personalized medicine, with secure access to comprehensive genomic and health data controlled by the patient. Treatments could be tailored more precisely than ever before, all while maintaining privacy. Think about streamlining the complex web of credentialing for medical professionals. A blockchain could provide an immutable, verifiable record of licenses, certifications, and affiliations, reducing administrative burden for hospitals and practitioners alike. Or tracking the pharmaceutical supply chain. Blockchain can create a transparent, tamper-proof record of a drug's journey from manufacturer to patient, combating counterfeiting and ensuring drug safety and authenticity. The platform envisioned by MediLedger Secure serves as a foundational layer upon which many such applications could be built, creating a network effect. The more patients and providers join the network, the more valuable it becomes for everyone involved. Let's revisit the patient journey with MediLedger Secure in more detail. Imagine Sarah, a young professional who travels frequently for work. She uses the MediLedger app. Her primary doctor in New York added her recent checkup results and updated prescriptions after getting Sarah's consent via the app. The actual records are encrypted and stored off-chain, but their hashes and access permissions are immutably recorded on the blockchain. While on a business trip in London, Sarah develops a severe allergic reaction. She goes to a local clinic that is part of the MediLedger Secure network. The attending physician requests access to her allergy information and recent medication list. Sarah, even feeling unwell, can quickly approve the request on her phone using her private key. The London doctor instantly sees the verified information entered by her New York doctor, avoiding potential adverse reactions and providing appropriate treatment immediately. The record of the London visit, including the treatment provided, is then added to Sarah's longitudinal record with her consent. When she returns to New York, her primary doctor can see the complete verified account of the incident. This seamless, secure flow of information across borders and providers is simply not possible with most current systems. Consider the data governance aspect. Who makes the rules for this healthcare blockchain? In a consortium model, a governing body composed of stakeholders, hospitals, clinics, patient advocacy groups, potentially MediLedger Secure itself, and regulatory advisors would define the rules for participation, data standards, consensus mechanisms, and updates to the platform's protocols. This collaborative governance model ensures the platform evolves to meet the needs of the ecosystem while maintaining trust and compliance. Let's think about the integration with existing electronic health record systems. This is critical for adoption by hospitals and clinics. MediLedger Secure would likely offer application programming interfaces, APIs, and connectors that allow established AR vendors like Epic, Cerner, etc. to integrate the blockchain functionality directly into their existing provider workflows. Doctors wouldn't necessarily need a separate application for routine tasks. They could request access, receive data, and submit new records to the patient's blockchain profile from within the familiar AR interface. Using the blockchain layer primarily for security, consent management, and interoperability. The role of identity management is also key, ensuring that patients are who they say they are and providers are legitimate is crucial. Robust Know Your Customer KYC and credential verification processes need to be integrated into the onboarding for all participants on the network. This might involve linking the blockchain identity to government-issued IDs or professional licensing databases in a secure, privacy-preserving way. What about the technology's maturity? Blockchain is still relatively young compared to established database technologies. However, enterprise-grade blockchain platforms and standards have evolved significantly in recent years. Frameworks like Hyperledger Fabric or Enterprise Ethereum are designed for the kind of permissioned, scalable, and secure applications needed for healthcare. MediLedger Secure would be leveraging these advancements, focusing on building the specific healthcare logic, workflows, and user interfaces on top. The patient experience is critical for adoption. The MediLedger Secure app needs to be extremely user-friendly. Managing private keys can be intimidating. The platform likely incorporates secure key management solutions, perhaps using social recovery mechanisms, multi-factor authentication, or hardware wallets, to balance security with usability, ensuring patients don't easily get locked out of their own records. Presenting complex medical information in an understandable format within the app is also important for patient empowerment. Visualizations, summaries, and links to educational resources could help patients better comprehend their health journey. The economic model for MediLedger Secure is another consideration. How does the startup sustain itself? Possibilities include subscription fees for healthcare providers or institutions based on usage or features, transaction fees for specific actions on the network kept low, value-added services, like providing tools for anonymized data analysis for research, always with patient opt-in consent, partnerships with insurance companies or pharmaceutical firms for specific, permissioned data services. The key is that the model must align with the core principle of patient control and not incentivize exploiting patient data. Looking ahead, we might see integration with wearable devices and Internet of Things (IoT) health sensors. Imagine data from your fitness tracker, smart scale, or continuous glucose monitor flowing securely and automatically with your permission onto your blockchain-managed health record. This real-time data stream could provide invaluable insights for both patients and providers, enabling truly personalized and preventive care. Artificial intelligence (AI) could also play a role. AI algorithms could analyze the vast amounts of verified longitudinal data managed via blockchain. Again, respecting privacy and consent to identify patterns, predict disease risks, or suggest optimal treatment pathways much more effectively than currently possible. The blockchain layer ensures the integrity and provenance of the data feeding these AI models, leading to more reliable results. In summary, the shift towards blockchain-based medical records, championed by startups like MediLedger Secure, represents a fundamental reimagining of how we manage our most sensitive information. It addresses deep-seated problems of fragmentation, insecurity, and lack of patient control that plague current systems. By leveraging decentralization, cryptography, and immutability, it offers a path towards a more secure, efficient, interoperable, and patient-empowered future for healthcare information. While challenges remain, the potential benefits for individuals, providers, and the entire healthcare system are too significant to ignore. Keep watching this space, as the way you interact with your health data is likely poised for a revolutionary change. Your health history, finally under your control, secured forever. That's the promise of blockchain in healthcare. Thank you for watching.